Welcome to Healthy Talk with BCH, empowering your wellness one conversation at a time. Today, we're excited to welcome back Heidi Kennedy, Director of Senior Life Solutions here at Boone County Hospital. Heidi joined our podcast in December to give us all the information about the Senior Life Solution program here at Boone County Hospital. If you haven't listened to that episode, Senior Life Solutions Unveiled Nurturing Mental Health in the Elderly, make sure you do. So let's start off with some exciting news. Congratulations on your recent award as the 2023 Rookie Site of the Year by Psychiatric Medical Care. Could you start by telling us about what that recognition means for you and your team?
First of all, it was a huge surprise. It was quite an honor. Being a new program, there's so many things that we have to do to get set up and introduce ourselves into the hospital and the community, and being recognized for all the things that we've done in the last year was phenomenal. I mean, it was heartwarming to know that not only are we impacting our community, but we've been recognized at that level as well. It was just a great thing.
Yeah, that's so awesome for you guys, for the hospital, for our community. What were some key factors that contributed to receiving this prestigious award?
One of the big things, three of the big things I should say, is psychiatric medical care. We follow our 3 C's, so it's care, compliance, and community. So along with caring for our patients, making sure that we're giving the best care that we can, providing the things that our patient needs, providing care to our community, to our hospital, but also a compliance to ensure that the things that we're doing kind of on the back end, making sure that we are checking all of the right boxes and doing all that stuff is very, very important. And psychiatric medical care takes that very seriously, but also working in the community and being involved with things, not just in Boone, but also with the hospital and surrounding communities as well. All of those things are kind of put into consideration when looking at something like this.
Let's move to the broader topic. What are some of the most common mental health challenges you see in Boone County today?
I would say one of the biggest things is a lack of resources that people are aware of. I have learned in the last year that Boone actually has an overflow of resources that just aren't well known.
Sure.
And so I think every week I find more and more things that we can help our community with and people that call for our help. And so that is one thing that I really want to focus on, especially in the next year, is getting out all of the resources to the community. Of course, we all need more therapy, more of those types of resources, but that's not the only thing that we can utilize to help with our mental health. So that is one big challenge, I would say, is the lack of knowledge of the resources that we have, having that stigma of not wanting to talk about mental health or not understanding that what is going on is actually a mental health related symptom or situation. And so the lack, again, of knowledge is just such a hurdle for everybody. And so I think that with the two of those, if we can work hard enough with our community, we could really make an impact.
How has the perception of mental health issues changed in Boone County over the years? I feel like when I was growing up, nobody talked about mental health.
I do think that as we have taken research and we have implemented that into kind of understanding what is going on with our bodies and with our mind and in society, we are taking that and we're realizing that some of the things we're noticing more that it's not necessarily a personality trait. One example that comes to mind is when somebody says, well, I'm such a worrywart. Mm-hmm. Yes, we are, we do worry about things on a day-to-day basis. We worry about our children, bills, cars, all these different things. But somebody that worries excessively and that kind of takes over, that is a symptom of depression, anxiety. And so we're learning those things now, and we're able to say, this is why this is happening. And the more we learn, the more we're understanding that this is a prevalent thing in our society. And so we're just noticing those things more, especially especially in our rural communities, because I feel the smaller communities that don't have access to a lot of different things kind of get left behind. And the more that we can bring that into these smaller communities, the more we're going to learn and be able to recognize that there is more of a mental health problem than what everybody is aware of. With Boone being a smaller area, I think that we're seeing more of that, not because we have more people with mental health, but just because we have more knowledge about it.
Sure, that makes total sense. So it is Mental Health Awareness Month this month.
It is.
Could you discuss the importance of this observance, particularly in our community?
Yes, definitely. This is such a big month for us. We plan for it. We get excited about it. Although we spend all year focusing on getting the word out and helping others learn about their mental health and learn about different things, May is that time where we can really kind of get out there and do fun things. It's not every month that, we can really, we do fun things, but this month we really like to kind of hone in on that. And so what we do is embrace everybody. We do focus on seniors at Senior Life Solutions. However, we really want the whole community to know and be more aware of mental health. And so working with the library, they are phenomenal with working with mental health. They do a lot of things with the community and getting that out. They do such a great job, and I would say they're a great resource to learn about mental health. We just want to let everybody know that mental health is there. There's nothing wrong with it. It's okay to acknowledge it. There's nothing to be shameful of, and just breaking down that stigma, because we do have a pretty bad one, unfortunately. And so just kind of making the community aware that it's okay, and talking about it and getting help is absolutely the best thing you could do for it.
Yeah, I think a lot of people, you thought if you had mental health issues, it was like suicide. Like
right.
That.
Yeah.
And there's so many more areas to it. And it doesn't have to be as big as I'm suicidal.
Exactly. Yeah. It could be something as small as, I haven't been getting as much sleep as I typically do, or I don't have an appetite.
You said the worrying.
The worrying. Yeah. Restlessness. So another good example of that would be, I'm a big reader. And so I can sit down and read for hours. But maybe there's some times where I do have some underlying anxiety or something going on, and I notice that maybe instead of sitting down and reading for an hour, I'll read for 10 minutes and then I'll need to get up and kind of do something. My brain's just not kind of calming.
Antsy.
Yeah. And so those are things that can tell us that we're being affected in even a minor way.
Yeah.
And so, yeah, you are very correct that mental health does not have to be a severe, life debilitating thing. It can be those small things that we're just not recognizing.
So could you highlight some of your key programs and initiatives that the Boone County Hospital has implemented under your leadership?
We've done so much in the last year and a half. It's been very exciting. A couple of things that we have done is our OPC, Jordan, she goes to the Adult Day Center and does things with them.
I bet they love that.
They love her, which is great, and she loves going there too. So we built a good relationship with them. We have also been able to get out and do some education, not only with the hospital, to help learn about dementia, which has been great. So I was able to work with the hospital and do some education with some of our nursing staff to help navigate through that. We have started doing a program once a month at the library, whether it's blood pressure clinic or playing bingo, that type of thing. We've also been involved in the expo for seniors in story. So just lots of different little things. But I would say our biggest one is just implementing our program, having the group therapy, the individual therapy, and building the relationships in the community with other care providers and also with members of the community.
Yeah, I would imagine that's huge. Having that trust and having someone that they feel comfortable with talking to about it makes the world of difference.
It does. We are Senior Life Solutions. However, it doesn't matter what age anybody is. If you need to talk, if you have questions, you're not sure what to do, that's what we're here for. And we do not just help the patients that are admitted into our program. We will help anybody that needs that help. That is one thing I love most about what we do is, yes, we do typically gear our services towards 65 or older, but we're also able to reach others in our community community and help them through whatever's going on and help them find those resources that Boone has that they may not be aware of.
That's fantastic. What are some of the unique approaches that your team takes to address mental health issues?
I would say that one of the more unique things that we do as a program is we are involved in more than just what happens within our walls.
Okay.
Let's say somebody has lost a spouse and they are not used to paying the bills or mowing the yard, those types of things. We found resources for them that maybe will help navigate through setting up a budget. And those things are important, that day-to-day stuff that we don't think about, especially when we have a partner that is doing those things for us. And then all of a sudden, not only have we lost that partner, but we also have to navigate learning to be alone. We have to navigate running a lawnmower. We have to pay the bills. We have to change the furnace filter. So there are so many different things that we have been able to help our patients with, which again, that kind of goes into the 3 C's that PMC has, which is that care part. But we also have formed relationships with people in our community that maybe don't have the resources to get what they need, and for whatever reason either don't qualify for our program, whether it's age, whatever the circumstances are. We have been able to build relationships where we help them navigate to make sure that they get to appointments, or I'm able to go sit at an appointment with them just so that they have somebody there, which I think is very important to show them that somebody cares and also gives them that direction to say, okay, Heidi may not always be there, but now I know what to expect. So the next time I can go by myself and I can do this. Those are some things that we have done with a couple individuals, which has been just amazing.
Yeah, that's very heartwarming hearing that. So how can community members get involved or support your efforts in promoting mental health awareness?
I would say talking to people. If you have questions and you're not sure how to approach people, what
it's a
to
sticky
say.
Subject sometimes.
It is.
You don't want it to sound something's wrong with you when it's not, but also navigating it gently if something is wrong.
And they don't want to offend them.
Yeah.
And it can be a sticky thing to say, hey, how are you doing? But
especially since we use that as a greeting half the time.
Exactly.
It's a passing. It's, yep, I'm good.
I would say it could be as simple as at the gas station, you go in and the clerk that waits on you every morning doesn't look like they normally do, giving them a smile, saying, I hope things are going okay. If you need to talk, reaching out to us, we can help facilitate some of those conversations. But also there are so many volunteer opportunities, especially in Boone County, that people can get involved with to help be a companion or maybe go get groceries for somebody. But I would say the biggest thing is just remember, we don't know what everybody's going through. Give them a smile, be kind, ask questions. And if you're unsure, reach out and let somebody know, hey, I'm not sure how to do this or what this person needs, but I really want to help them.
Are there any upcoming events or campaigns that the community should be aware of?
In October, Boone County is having an expo, which is coming up, and we're extremely excited about that. It is going to be geared towards seniors. So we will have different booths, different vendors out there that provide services specifically for individuals 65 or older, which is going to be a great thing. We're going to have food and prizes. We're going to be covering Medicare, dementia, and some other issues. Another thing that we're going to be doing, which we did last year, is helping the library with their kickoff reading program for the kids.
I love going to that with my kids.
I do too. So we're excited about that. That's coming up in June. Okay. So we will be doing that. But our big thing that we're excited for is that expo coming up in October.
And that's at
it's at the fairgrounds. Yes.
At the fairgrounds.
Yep.
Is there signups yet or?
Yes. So if you're interested in being a sponsor or having a booth, you can reach out to me, Heidi Kennedy, at Senior Life Solutions. My number there is 515-433-8713. And I will have all of the information for that. There are different sponsorship levels and you can have either a half booth or a full booth. So there are lots of opportunities to get involved with that.
Awesome. What are some of the biggest challenges that you face in your role, and how do you address them and overcome them?
I would say one of the biggest challenges is probably the stigma that everybody has regarding mental health. But as far as when we're talking to people about our program, the number one thing that everybody says is, I don't like group. And I don't blame them. I don't like to be around a lot of people, but our group is very small and intimate.
How many people do you think you have in a group session?
A maximum of 10 people.
Oh, okay.
So anywhere from 2 to 10. And I always try to reassure them. Everybody says that they don't like that.
And everybody's probably going in with the same thing. They don't want to go in because they're nervous.
Exactly. And so I just encourage them to try it. We are 100% volunteer program. And so if they don't like it, then we can help find something else. So I would say that is a hurdle. Another hurdle would be whether or not they are comfortable talking about their personal things. So really just getting to learn about the person and kind of what their needs are is so important for us. But reaching the community and getting out there and having people understand that it's okay to ask for help, that I would say is the biggest thing, where individuals will say, I really think this would be good for my mom, or I noticed that this person is struggling, but they don't want to say anything to them. They don't know what to say. They don't know who to reach out to help them. And so just that lack of knowledge, which is why we do things like Mental Health Awareness Month and our community involvement to do that education and get that word out there for them.
Do you have any success stories you could share?
We have had individuals come to our program where they just thought there was nothing left for them. They had lost a spouse and they had other challenges going on, and not leaving the home and not being involved in things that they had been for many, many years. And then within 6 months, they were out in the community again, communicating with their family. Their health had improved, just their mood in general. And so it not only got them their life back, but it also helped them to be able to better take care of their family, better take care of their home, getting out and getting involved in the things that they once were again. And those are the things that we love seeing as we work with our patients, seeing when they come to us and where they're at, and as they grow. It's just such a great thing to watch. The Ames Tribune is putting out an article that has some success stories in there as well, and so I'm excited to be able to read
look for that.
Yeah, look for that. It'll be coming out this month.
What advice would you give to someone who's struggling with mental health issues and might be hesitant to ask for help or seek you guys out?
Talk to somebody. It doesn't have to be a quote-unquote mental health professional. It could be the neighbor. It could be your spouse, your child, your friend. It could be anybody. Just talk to someone.
Don't bottle stuff up.
Just let it out. Hey, I'm having a hard time today, or I'm anxious. It can be anybody. Talk to your doctor. I would say that they are probably one of the best, because they're not going to judge you.
Right.
They're not going to haunt you every day about how are you feeling, what are you doing, this type of thing. So just tell somebody, talk to somebody, even if it's just a couple words. Write it down. If you don't want to talk about your personal things, call and say, hey, I have a friend that's feeling this way. Just try to talk about it. Try to maybe read a little bit about it. Just don't bottle it up. Don't keep it to yourself. It is important to have that outlet.
Do you have any resources that you would recommend for people who might be struggling with mental health?
There are so many.
Do we have enough time?
Exactly. I love this question. We have so many things. We have providers that are coming to our clinics that are going to be working with mental health, having that within our family practice and having that opportunity to be able to work with them is very exciting. We are going to be seeing that coming very soon. Also, we have programs like RSVP that provide companionship. Somebody who maybe can't leave the house, they go run and get groceries for them. Something as simple as a phone call once a week. So RSVP is phenomenal, and they are a part of the hospital, and they're lovely. I love working with them. Another good one is the Adult Day Center. Not only do they provide somewhere for individuals to go, but they are going to provide support for caregivers. They have all of these things. And again, I'm going to mention the library. Our library is one of the best I've seen in all of Iowa. They're so supportive. They have so many resources. So I would definitely say our library. I would say our biggest asset is just the hospital in general. If you walk into the hospital, it doesn't matter if you're in the emergency room, you're seeing a surgeon, you're going to the wound center. It doesn't matter where you're at. They're all willing to listen and help. So if you are having any struggles, come in. We're here to help you, and anybody will steer you in the right direction.
Looking to the future, what goals or developments are planned for Senior Life Solutions program? It feels like you've done so much, but you've only been a year and a half?
Yeah, a little over a year and a half. And so we have so many things that we want to do and so many different goals. One of the fun things that we did is there's a program at Iowa State called OLLI, and it is an alumni education platform. It's for everybody, but I think the majority of them are 65 or older. So we were able to teach a class with them about aging, what normal aging and not normal aging. So my goal for next year is to be able to provide longer classes that will be 6 to 8 weeks long. It's virtual. Some of them are in place. So that is a goal that we have coming up for that. And then allowing ourselves and our community to grow more and be able to reach more people. I think that probably is our number one goal going forward, and learning that not only are we supporting the Boone community, but we're also supporting Story County and the counties surrounding us.
Do any of the counties around us have Senior Life Solutions?
There is a program in Webster City. There's one in Perry. There's one up in Hampton, one in Winterset. So there are options all over the state of Iowa, actually. There's some in Minnesota. Senior Life Solutions is all over the country. They're just individually affiliated with different hospitals.
How do you see the future of mental health services for our area?
I think if I had a dream, it would be that everybody that needs it would have what they need to be able to put into place in a more timely fashion. Because of the funding and because of the resources that we have, there are times where individuals have to wait. And I know when I'm upset or I'm feeling down, I'm feeling that way right now. I may not be feeling that way in 2 weeks when there's an appointment open. So my dream for what mental health would be is that when somebody needs help, we can get that for them within that 24-hour period. I hope that our legislature and our governor works to get the resources and the funding that all of our communities need, and that we're able to provide those services, because after funding was cut a few years ago, it's not been great. So my dream is to hopefully see Iowa continue to excel in providing those services and bringing those services to Boone County.
Well, I can definitely tell that you are extremely passionate about this. So on a personal note, what drives your passion for mental health advocacy?
I would say my personal experiences with mental health, not only for myself, but also with my family. And in my nursing career, I've seen so many people struggling. I would say there's so many out there that not only would benefit from and have a greater quality of life if they were able to get the help that they need for mental health. I think that is what drives me, is knowing that if we can touch just the smallest part of that and improve their lives and see them grow, see our communities grow because of it, that's really what drives me, is to see people improve and that quality of life get better.
As we wrap up, is there anything else you'd like to share with our listeners about Mental Health Awareness Month or mental health in general?
I just want everybody to know that it's okay if you feel like you're having mental health concerns. There's nothing wrong with you. It's absolutely a normal thing that human beings go through. I just want everybody to know that there is help, and we would love to hear from you. We would love to help you find the resources that you need. We're available at the hospital for anybody to reach out to us. So just knowing that it's okay to talk about what's going on with you is the biggest thing. Understanding what your needs are and what you can do to get better is also very, very important. Please know, don't be ashamed, and don't worry about others thinking badly about you. That's our goal, to make sure that everybody understands what everybody's going through.
We spend so much on our physical health.
Right.
But mental health, like, that is part of your overall well-being.
It is.
And you need to take care of that and address that when it needs work.
You're right. Just as eating healthy is important and not taking in negative, bad, toxic things into our body, we also have to treat our mind that way. Being careful of what we're putting into it is going to allow for it to be healthy. But just like any other illness for the body, diabetes, heart disease.
Right. If you had a heart attack, you're not going to not go to the hospital.
Exactly. Depression and anxiety, bipolar, schizophrenia, all of those things are very similar to that, where there are things that you can do to prevent the symptoms, but also there are things that you can do to make those illnesses comfortable, have a good quality of life with them. Just because you're a diabetic doesn't mean that you can't enjoy life.
Right.
So if you have depression, if you have anxiety, that doesn't mean you can't enjoy life. That doesn't mean that there's not tools that you can use to be healthy, even with that underlying illness.
Well, Heidi, thank you so much for joining us today and for all the amazing work you're doing. To our listeners, remember that mental health is just as important as physical health, and it's okay to seek help. If you or someone you know would like more information on Boone County Hospital's Senior Life Solutions program, call 515-433-8713 or check out our Senior Life Solutions Unveiled, Nurturing Mental Health in the Elderly podcast episode. That's all for this episode. Stay tuned and subscribe for more engaging episodes on Healthy Talk. And until then, stay informed, stay healthy, and keep the conversation going with Healthy Talk.